Millions of Americans out there can't afford to cover the cost of their prescriptions. So, what are you supposed to do when you can't afford your medication or if you find yourself uninsured? Well, that's exactly why we're talking with public health expert Tori Marsh.
Over the past couple of years, we have noticed that insurance has started to cover less and less, and Americans are on the hook for higher out-of-pocket costs. On top of that, likely because of the coronavirus pandemic, more than 44 million Americans are uninsured right now, which makes it hard for them to access affordable and consistent healthcare. When Americans don't have access to this healthcare, they are forgoing these essential services and healthcare visits, which ultimately can lead to costly and dangerous effects down the line.
What steps can Americans take right now in order to lower their out-of-pocket costs?
Yeah, so there are 3 steps that I always suggest people take. The first one is to shop around for your prescription medications. What many don't know is that medications can vary in price pharmacy to pharmacy, and in some cases upwards of hundreds of dollars. And so GoodRx provides an easy way for people to price compare for their prescriptions and also access discounts to save at the pharmacy. Secondly, I always recommend that people have open, honest conversations with their healthcare providers about their budget and how much they're spending out of pocket. Providers don't often know what insurance plan you're on or where you are in your deductible, so telling them this can help them guide you towards savings tips or even switch you to an alternative that might be a little bit more cost effective. The third is to really try and access manufacturer savings for drugs. Manufacturers often offer things called patient assistance programs or drug copay cards, which can really lower your out-of-pocket cost. To see if your drug has anything available, go to goodrx.com, search for your drug, and scroll to our savings sections where we detail any options that might be available to you.
All right, that's really good information. And do you have any advice as far as how patients can actually enroll into an assistance program?
Yeah, no, it's a great question, and it can be a little bit tricky. The best advice I have is for people to see if a patient assistance program or copay card is available for their drug through GoodRx. We also detail any eligibility requirements or anything they might need to submit in order to show their eligibility. So that's the best way to do it. Often it can be confusing, so also calling up the manufacturer and asking how you sign up is a great way as well.
You can always find this segment and more on our website at firstcoastliving.net.